Hello everyone and welcome back to the channel. Today we are diving deep into a topic that affect the athletes from weekend warriors to allied professionals, sports specific injuries. Whether you play football, run marathons or swim competitively, understanding these injuries is key to staying in the game. We will understand what are they, why do they happen and how can we prevent them. So let's start it. Coming to the next content, here the roadmap for today. We will begin with the definition and classifications of sports specific injuries, talk about the biomechanics and risk factors, look into a mechanism of injury, and review a few sports specific case studies, and finally, we will cover prevention strategies, the role of sports physiotherapists, technological innovations, and even the psychological and ethical aspects of the injury management. What are sports specific injuries? Coming to the next slide. First, what exactly are sports specific injuries? A sports specific injury is any injury that occurs directly as a result of playing a sports or physical activity, meaning the mechanic is unique to the demand of that sports. Think about it. A baseball pitcher might develop thrower's elbow, while a marathon runner is prone to runner's knee. These aren't random, they are directly linked to the repetitive, high stress actions common in those sports. We can classify sports injuries in a few ways: by onset, by tissue, by severity. First one, by onset, they may be acute, subacute, or chronic. If it is acute, like a shoulder dislocation in judo, or chronic, like Achilles tendinosis in sprinters. Next one, by tissue affected. Soft tissues such as the muscle, ligament, and tendons. Hard tissues like bones and cartilage, or even the nerves, like brachial plexus injuries often seen in rugby. Coming to the third point, by severity. So the sprain and strains may range from grade 1 to 3. And injuries can include partial or complete tears too. It all helps us understand the injury better. Coming to the types and the examples. So the detailed table of injury as I mentioned here. Let's break it down. External injuries, internal injuries, joint injuries, bone injuries, and overuse injuries. The first one, external injuries. How it is happen? It's happen when the skin or surface tissues get hurt. Think abrasion, bruises, or cuts. Internal injuries that affect the deeper structures like muscle, bones, and joints. And then comes to the joint injuries, it involves the dislocations or instability. And comes to the bone injuries, include all kind of the fractures from green stick fractures in kids to comminuted fractures where the bone shatters. And coming to the last injury, that is the overuse injuries. It is common in sports like tennis, hello tennis elbow, or running, where the repetitive stress leads to problems like shin splint or tendinitis. And for example, okay, if it is the football, cricket, running, or swimming. Okay, first one is take a football. The ACL tear often happen when a players land from a jump with their knee in a vulnerable position. In cricket, the fast bowlers can develop stress fractures in their lower back from repeated hyperextension. If it is a long distance runners are at risk for tibial stress fractures, and swimmers they often face shoulder impingement from constant overhead strokes. And then coming to the next slide, it is the biomechanics. Why do these injuries are happen? Okay, so now let's get a little scientific. The injuries aren't just bad luck. Biomechanics plays a huge role. Injuries happen Injuries happen because of forces acting on our bodies like tensile, compressive, or shear forces, but often it's about biomechanical fault. Think of basketball players landing awkwardly, leading to ACL tears, or fast bowlers in cricket stressing their spine because of repetitive rotation. Essentially, the poor biomechanism can drastically increases the injury risk. So improper biomechanics really increases the risk of injury. Coming to the next slide, the part C, sport specific risk profiles. So each sports has different risk profiles. Here we mentioned some kind of sports: contact sports, non contact sports, water sports, combat sports. The first one is contact sports. In contact sports like rugby, traumatic injuries like ligament tears and concussions are common. In contact sports like running, overuse injuries like stress fractures are more frequent. In water sports, overhead actions often lead to shoulder problems. And in combat sports, we see musculoskeletal trauma and even nerve or blood vessel injuries. Coming to the next slide, intrinsic risk factors. What makes you more susceptible to an injury? These are called intrinsic risk factors. So, a previous injury that is significantly increases your risk. If you have torn your ACL once, your risk of tearing it again or tearing the other one goes up. The next point is that muscle imbalances. So the muscle imbalances playing a main role in intrinsic risk factors. That's like a poor hamstring to quadriceps ratios can predisposes you to injuries. And things like poor flexibility or proprioceptive deficits, that's your body's ability to sense its position, can make you more prone to sprains and strains. Some risk factors are within your control, like muscle strength and flexibility. Others, like your age or gender, are not. Female athletes, for instance, have a high risk of ACL injuries, partly due to hormonal and anatomical differences. Transition to the next slide, the extrinsic risk factors. Then we have extrinsic risk factors, things outside of your body. First one is the training load errors are huge. It is too much too soon without proper rest and your tissues can't keep up. The second one is the equipment. So here the equipment matters. The wrong cleats can lead to that ankle sprains. Even the environmental conditions also playing a role in extrinsic risk factors, like the cold temperatures can increases muscle strain risk, and the playing surfaces, the synthetic turf for instance, has been linked to higher ACL injury rates compared to the natural grass. Coming to the next slide, the mechanism of injury, MOI. So, how do these injuries actually happen? We call this is the mechanism of injury or MOI. For ACL tears, it's often a specific landing error pattern, like the knee collapsing inwards, known as the valgus collapse. Second one is the rotational injuries that can affect things like meniscus, and hyperextension injuries are common in throwing sports, impacting the ligaments like the ulnar collateral ligaments. These biomechanical patterns are crucial to understand for both prevention and rehab. Coming to the next slide, the example of sports cases. Let's look at some real world examples. The first one is the football. In football, most ACL injuries happen during cutting or landing movements, often without contact. The cricket fast bowlers face lumbar stress fractures because of repetitive spine extension. Long distance runners often get tibial or metatarsal stress fractures from repetitive loading. And then last one is the swimmers. If it is the swimmers, they deal with that shoulder impingements due to repetitive overhead strokes. And coming to the next slide, the common sports injuries. Here a quick breakdown by sports. First one is the swimmers. Swimmers often report the shoulder impingement or even swimmer's knee. The next one is the tennis and badminton players. They develop the tennis elbow and ankle sprains. And the third one is the cricketers. If cricketers, especially the bowlers, suffer from lumbar spine injuries and finger dislocations. And the fourth one is that runners. Runners sees Achilles or patellar tendinopathy. And footballers, they frequently sustain the ACL tears, hamstring strains, and groin injuries. The coming to the next slide, the tissue response and heal. Coming to the next slide, the tissue response and age gender factors. How does the body heal? Our body's tissues respond differently to injuries. The muscles form scars, tendons go through the collagen degenerations, and bones remodel through the callus formations. Age and gender also play a role. The young athletes suffer growth plate injuries. The female athletes have higher ACL risk due to biomechanics and hormones, while older athletes are prone to degenerative injuries. Coming to the next slide, the earliest symptoms and functional deficits. How do you know if you are injured? So look for if anyone having pain, the sense of pain, swelling, warmth, redness or bruising, a loss of range of motion, or maybe a clicking or popping sensation, or a feeling of instability like your joint is giving way. And then functionally you might notice if it is reduced the strength of the muscle or impaired coordination or altered the movement patterns and decreased the endurance level or loss of power. Your jump height or sprint speed might drop. And then move to the screening tools. With that, like the functional movement screen or Y balance test or single leg hop test are very useful to identify the high risk athletes. And coming to the next slide, the prevention and strategies. Now for the good stuff, the prevention. The best way to fight sports injuries is preventions. So this includes the primary prevention, focuses on stopping injuries before they even happen, like using proper warm-up protocol such as the FIFA 11 warm-up routine. The secondary prevention is about early diagnosis and rehabilitation to catch issues before they get worse. And tertiary preventions focuses on proper return to sports testing and load management to prevent re-injury. And then three levels like the primary, secondary and tertiary, depending on whether we are trying to stop the injury, catch it early or help the athletes return after an injury. Coming to the next slide, the role of sports physiotherapist. Here, the sports physiotherapists are your injury superheroes. This is where the sports physiotherapist comes in. They provide a crucial on-field care. They are vital for injury diagnosis and rehabilitation with the sports-specific exercises. They offer preventive education, correcting movement patterns, and they make crucial return to sports decisions based on functional testing. And transition to the slide part L, technological innovations. The technology is also playing a huge role in understanding and preventing the injuries. First one is that wearables can monitor the load and fatigue. AI and machine learning are being used to predict the injuries. And third one is the advanced imaging like ultrasound elastography helps detect that tendon issues. And the last one is that isokinetic testing helps identify the strength deficits. And transition to the slide part M, psychological considerations. The injuries don't just affect that body, that they affect mind too. Many athletes experiences a fear of re-injury which can delay their return to sports. The next one is the depression. So here the depression can be a real issue post injury, especially for elite athletes whose identity is so tied to their sports. And the third one is that rehabilitation complaints is hugely influenced by the athlete's motivation and belief system. Athletes with strong psychological support tend to return faster and perform better after the injury. And coming to the next slide, legal and ethical concerns. So, finally, there are important legal and ethical considerations. The pressure to play can create a conflict between an athlete's health and performance demands. The next one is that informed consent, that is crucial especially for surgeries or return to play clearances. And third one is that load transparency. It is openly communicating about training loads between the coaches, therapists and athletes is essential for athlete well-being. Yeah, here. Coming to the last slide. And that brings us to the end of our session on sports specific injuries. We have seen how different sports being unique risks, how injuries occurs and how we can prevent and manage them. Thank you for your time and I hope this help you understand the science and care behind keeping our athletes safe and performing at their best. I hope this gave you a clearer understanding of what these injuries I hope you this gave you a clearer understanding of what these injuries are, why they happen and how we can work towards preventing them. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more content like this and hit that notifications bell so you don't miss our next video. What are your experiences with the sports injuries? Let me know in the comments below. Stay safe, stay healthy and I will see you in the next video.